decriminalization, and regulation. And I think it's fair to say that on all three fronts, there's a good case to be made that there's a need for revisiting the current regime, for questioning the degree to which the regime actually facilitates those three dimensions of the public health approach. It is now, after many years of advocacy and considerable accumulation of scientific evidence, fairly clear that the implementation of various harm reduction measures can be accommodated without too much difficulty within the current regime of drug control. Dating back even to the leaked opinion of the Legal Affairs Secretariat of OPSEN UN Drug Control Program, recognizing that various harm reduction programs such as needle and syringe programs, opioid substitution therapy, drug consumption rooms, and so on, could indeed be accommodated within the current drug control regime, although a number of states have continued to resist that interpretation and certainly the implementation at the domestic level of many of those programs, as we know, and as WHO underlined yesterday at its session on public health and drug policy. It is, I think, fairly well settled now that you can implement those things without running afoul of the conventions. Whether, in fact, states do that is another matter. But of course, simply having needle exchange programs and OST and drug consumption rooms isn't going to be sufficient if you want a truly robust public health approach to the harms that drugs themselves can sometimes cause and the harms that drug policy often causes. And so we need to look at another dimension of a public health approach, and that is the question of decriminalizing to various degrees and in various circumstances activities related to drugs, including, of course, the question of possession of drugs for personal use. And here too, although the argument needs to be perhaps a little more robust and requires a few more steps, there is a reasonable case to be made, and we are among those who have made it, that in fact the existing treaty regimes can be properly interpreted to permit the implementation of decriminalization in various ways. And in particular, the fact that the conventions refer to the fact that the obligations of criminalizing various activities, including personal possession for personal use, are to be subject to the constitutional principles of a member state is, of course, the key basis upon which member states can stake out the flexibility for adopting decriminalization in various ways. But that is even more resisted by more member states than the implementation of harm reduction programs, and so there's work still to be done on that front as well. With respect to both harm reduction and decriminalization, the fact that to adopt those aspects of a public health approach requires a member state to swim against the tide of prohibition that is the overarching imperative of the current drug control regime, I think should in and of itself be good enough reason to question whether the current regime is really public health friendly. But the fact remains that you can get there within the current public health regime. But then when we turn to the third element that I suggest needs to be part of a comprehensive public health approach, the question of actually moving to some sort of regulatory approach, this is where we run into even more difficulty with the current drug control regime. I think, as Uruguay has shown in the case of cannabis, it is certainly open to member states under the current regime to stake out a particular flexible interpretation of the treaties that would allow you to go so far. But I think the fact that that remains very much the exception and subject to extensive criticism makes an even stronger case that there's a need to revisit the current drug control regime. On all three fronts here, the extent to which the drug control regime and its political use and interpretation by member states is operating as a barrier to the implementation of the public health approach, whether it's harm reduction services, decriminalizing possession for personal use or other activities, or actually moving to a regulatory model. In all of those cases, the fact that the drug control regime as it stands now is biased against, and one needs to make a strong and robust argument to adopt those approaches, should give us some cause for concern as the evidence mounts of the individual and public health harms of the current drug control regime. So I think that that provides a good opportunity then to hand it over to the other speakers to illustrate some of the ways in which the current regime is producing some of the public health harms and to speak to the question of regulation.